Good evening and welcome to Doctors on Call. I'm Dr. Paul Sanford, an internal medicine physician with St. Luke's Internal Medicine Associates, and I'm going to be your host for tonight's program, What Are You Seeing in Your Office? Success of this program is very dependent on you, the viewer, so please call in your questions and we'll do our best to address them. Our telephone numbers are on the bottom of your screen, and our panelists this evening include Dr. Kathryn Dobbs,
Hi.
Family Medicine at the Community Memorial Hospital and in Cloquet, and Dr. Ken Ripp, Family Medicine Physician with the Raiter Clinic in Cloquet, and Dr. Addie Vittorio, a Family Medicine Physician with St. Luke's Mount Royal Clinic. In our medical students answering phones tonight are Kaylee Evers of Rochester and Lauren Summers of Janesville, Minnesota, and Molly Vale of Elk River, Minnesota. And now on to tonight's program, which is on What Are You Seeing in Your Clinic? So, Dr. Dobbs, what are you seeing as far as flu and flu vaccine?
Well, we have seen a lot of stomach flu, which is not to be confused with influenza, which is what the flu vaccine is for. The flu or influenza that we vaccinate against is more of a respiratory illness with cough and fever and body aches, whereas stomach flu is obviously vomiting and diarrhea.
Okay, so that flu shot isn't going to protect me from vomiting and
Not at all.
diarrhea. Rats. Okay. And Dr. Ripp, what are you seeing these days in the clinic?
As the sports teams begin to wind down, so our sports injuries are tailing off as the next season starts. We'll see more of those sports injury. A few aches and strains from people getting outside in the fall weather. We haven't had any snow shoveling injuries yet, but that'll be coming soon. But and then as school started, we saw our first round of upper respiratory infections. That sort of waned, but I'm sure we'll be seeing the next wave coming.
Okay, well, good. And Dr. Vittorio, how much of what you see in the office is related to ongoing problems versus new acute problems?
I guess I would say that probably 50% of what's coming in as patients think is an acute complaint or something that just happened to them that they need treatment for. Half of the time can be attributed to some of their chronic medical conditions like COPD or CHF, and half of the time it is a true sort of infectious illness, typically viral.
All right, well, that's helpful. And Dr. Dobbs, what typical chronic illnesses do you manage in your clinic?
We manage diabetes, a lot of diabetes, heart disease, high blood pressure, COPD or emphysema, asthma.
Well, that's great. And I know as an internist, I see a lot of that too. And I'm the only internal medicine person here, the smart ones of the family medicine doctors. Well, Dr. Ripp, how about other things in the office? Do you ever talk about things like living wills or advanced directives?
That comes up especially when people are older and they come in for their wellness exams for Medicare. That's one of the talking points that we try and hit on. And that's a chance for us to make sure we're addressing all the preventative stuff that's so important. I have a med student working with me, Lydia, who's been with me for the month, and I talk about how every visit I sort of run the gamut on, okay, have they had their immunizations? Are they up to date on their mammograms or their colonoscopies or whatever preventative services might be needed, try and get it addressed, even if they're there for a stub toe. So and that takes a little extra effort, but in the long run, it makes it better for the patients. Patients don't want to come back. If I can say, okay, let's get it all taken care of today, that's what we try and do.
Yeah, and I would tell you that living wills aren't necessarily for the elderly.
Yes, amen.
And there are actually really great populations who are younger who would benefit from having a live-in will. Single people, persons recently married, persons in same-sex relationships who may be not married, all those people. And often when I address it, I bring it up around the age of 45 to 50, which seems surprising to some people. But it's a great time to get it done while you are kind of in a very stable part of your life.
I agree. I mean, just letting your loved ones and your care providers know what you would want done if you were unable to speak. I have that as a directive so that if ever I've had some catastrophic thing and my doc says that there's no chance I'm going to be able to recover and have a cup of coffee and read the paper, that it's an act of love to let me go. and a lot of families struggle with that. Speaking of struggling, do you see a lot of depression in your office?
We do see a fair amount of depression and anxiety, and it does seem to get worse in the winter months.
Okay, I know it's the big topic for next week, and it's amazing. I figure that probably a large part of our work is treating anxiety, depression, mental illness.
With the weather changing, I guess I'm preparing my patients with pre-existing depression for that, and talking about vitamin D supplementation, talking about getting outside and exercising safely in the sunlight, when we get that sunlight throughout the day.
Yeah, thanks for bringing that up. And Dr. Ripp, being an exercise maniac, what do you have to recommend for people of all ages in terms of good, healthy exercise?
Well, I do agree. Trying to get out for the brief, if you can get out lunch, even just for a few minutes to walk outside or do anything at lunch, and that's when I escape and get out and get at least one ski in there, and I try and ski later on in the night. But there's such a brief period when the sun is up. Vitamin D is helpful. That's a double-edged sword. You have to watch about taking too much of it.
Yeah.
So one of my other passions is the bone density. I'm a clinical densitometrist as well. And there's a recent study out that too much vitamin D is actually detrimental to your bone density. So probably around 1,000 or less is all we really want to take. You go beyond that as a negative impact on our bones. And we always thought that more was better. And so we have to be careful. Now, if you have deficiency, that's different. That needs to be treated. Yep. But if you're just taking it as a supplement, taking too much of it can be a bad thing.
All right.
So.
And how about Dr. Dobbs? Is soda pop good for your bones now that we're talking about bone density?
Not at all. The phosphoric acid in the sodas definitely leaches a lot of the calcium and the strong bone properties.
Okay, well that's good to know. And what age do you recommend people get their first bone density study?
We usually start those depending on the risk factors and diseases, but barring any others, start screening at age 65.
Okay. And it always seems like women are told to get bone densities, but are there any men that should get bone density studies?
There certainly are, and Dr. Dobbs talked about risk factors. And so men who have had long-term steroid use, men who are chronically underweight due to medical conditions or other causes should get bone density. If there's a strong family history of osteoporosis and multiple relatives, you should consider that.
Okay, that's great.
And
great.
Smoking also puts us at risk for low bone density. So that's another big risk factor.
Yeah. Is there any part of our body that isn't adversely affected by cigarettes? Everything.
I honestly think of it.
Everything. Please don't smoke. Yeah. If it weren't for tobacco, we'd all be selling Buicks.
That's right.
So, anyway, talking about other vaccinations, what say that I'm just turned 65. What vaccinations should I be getting? Any one of you?
Well, you want to you get your flu shot for sure. Then there's the pneumonia shots. There's actually 2 of them, and getting them both. But the current recommendations is a year apart, but that might be changing. And then there's the shingles vaccine, the vaccine against shingles. That's a two-shot series, and that's at 65. So if you haven't had it by then, it's a great time to get it. So those would be the one, and then a tetanus shot with that pertussis component is also. So that would round you out pretty well. Now, if you're going to be taking a great vacation, some wild vacation to the Caribbean, or maybe going to some adventure travel, then a hepatitis A vaccine might be in order. So,
excellent, excellent. All right. Now, as far as how about people who have other conditions? Now, let's say I've had a bone marrow transplant. Should I get a shingles shot? It may be, I don't mean to have it be a tricky question, but it being some people shouldn't get a shingles shot if they've had a bone marrow transplant because it's a living virus. And so it's always worthwhile to avoid living attenuated viruses if you've had something like a bone marrow or heart transplant. I shouldn't have asked that here. That's terrible. Oh my. Well, let's talk about diet. Since I love cheeseburgers, should I eat cheeseburgers every day?
You shouldn't probably eat anything every single day. And I think, variety is what's necessary. That's what I did in a former life. I was a dietitian.
Oh, wonderful.
And so, everything in moderation. There is some new evidence coming out that diets high in meat, which is what a lot of people are using for weight loss right now, are not necessarily healthy for you from a cancer standpoint and from a cardiovascular standpoint. So I think the point is that we eat lots of fruits and vegetables, a good source of calcium, whether that be dairy or not, and protein, either plant or meat-based protein.
Oh, that's great. That's great. And what do you have to say, Dr. Ripp, if somebody comes in and they're a little bit generous in their weight? How do you help them lose weight while keeping a good self-image and knowing that they're a good person?
I think the biggest thing is just to engage them and see where they're at and what changes they're willing to make. And it's a negotiation. And a healthy diet is key. I try to encourage my people to eat regular small meals if they can move a little bit after each meal. And as I say, you don't have to run a marathon, but if you can just move a little bit more and make some better choices eating, we can all make better dietary choices. One of my pet peeves is making sure people are not drinking their calories. You can, with pops, juices, and even coffee and teas can be loaded with sugar if they're sweetened and flavored and whatnot. So you can drink a lot of calories and not realize it. So a quick story, one of my friends was gaining weight and he had a coffee shop open next to his office and he was going down thinking he's healthy, having a chai tea every day until he realized that there was 500 calories in that chai tea.
Oh,
and he stopped doing that and everything fixed itself. But so you can drink a lot of calories easily. So what you do is you keep working, and if the patient wants to meet with a nutritionist, if they're that engaged and feel like they need that they're a great resource and can help them through it. A lot of times when our patients cross over and become a diabetic, it's such a nice opportunity because they get all that education from a diabetic educator and from the nutritionist to see and maybe hopefully find how they're going to engage and make those lifestyle changes.
excellent, excellent. Well, we've talked about food and exercise. My favorite topic, Dr. Dobbs, sleep. How much sleep should I get?
That's variable, certainly based on age and the person. Certainly children, babies need a lot more sleep. It does seem that the older we get, the less sleep that we need. In the elderly population, they just don't seem to need as much sleep.
Okay.
But, the old 7 to 8, even 9 hours
Okay. Well, how
for
about
the average adult.
one of my patients today came in and was just said they slept 10 hours last night and they're still exhausted. What should I be thinking about?
Sleep apnea.
Okay. And how do we diagnose sleep apnea?
So you have what's called a sleep study in a sleep lab. There are sleep labs in Duluth and Cloquet, and basically they monitor your breathing, heart rate, oxygen levels while you're sleeping to see do they dip down, and in what position of sleep do they dip down if they do.
Okay.
And the thought is that disrupted sleep actually leads to chronic medical conditions or chronically high levels of cortisol, which is our stress hormone. So it actually, uncontrolled sleep apnea can contribute to heart failure, to diabetes risk, to obesity. And we do see this where patients who get their sleep apnea treated have more energy, but they also start losing weight and their medical conditions improve as a result.
Oh, that's great. And we see a lot of atrial fibrillation in people with sleep apnea, and that's a big cause of strokes. Well, we have a call here. What is the youngest age you can get a flu shot?
6 months.
6 months.
Okay.
And at 6 months, you would get 2 doses, one a month apart.
That's good to know. I didn't know that. My youngest patient is 70. All right. And then here we've got a call from Cloquet. You guys are here. After taking Megared for 1 month, I started to bleed more. Should patients be worried that taking Megared is an anticoagulant? Now, I don't know what Megared
I'm not sure
is.
what that is. And so anytime someone goes onto a supplement and it's having a negative effect on them, I would say simply stop it. If they think that they really need to be on it, then I think that I'd stop it and then go talk to their physician and bring it in so they can figure out what is in it. Because a lot of times with supplements, it's hard for us to know. We have special resources we can do to try and figure out, well, is there any evidence that is helpful at all? So I would say if they're having a side effect, I would stop and then go talk to their doc about it.
Well, and it really is helpful to bring the jar itself
And I think we all need to realize that supplements are not necessarily regulated. They are monitored for purity by some private organizations or some larger organizations, but we really don't know how much of what they say is in them or how much of other things are in them.
Good point.
You can, and all of us here could grind up the table and put it into a pill and call it what we want and say, as long as we say it's for health, we can sell it until enough people get hurt.
Yeah, and FDA doesn't monitor supplements. No. Okay, well, here's another question, and their medicine was changed from lisinopril to metoprolol. Is heartburn a side effect, Dr. Vittorio?
I would tell you that off the top of my head, I do not know the direct answer to that question. And you know, doctors are not supposed to know everything. We have the resources to look these things up. The best resource for that patient may actually be talking to their community pharmacist, so the person that distributes the medication.
Amen.
And with any side effect, the ultimate experiment is talk to your doctor, go off it, go back on it, go off, and if the symptoms, every time you take your metoprolol, you get heartburn, then for you, that's a side effect. You're not allergic, it's just a side effect.
Dr. Ripp is right. Talk to your doctor before you decide to do these things.
Don't do it on your own.
Yeah.
So, but
a lot of things for me feel like heartburn, but it might be my angina.
Right.
Oh, okay. Well, here we've got an email question. What's the world coming to? What percentage of your patients smoke, and what are you doing about it?
Ooh.
How about Dr. Dobbs?
I honestly couldn't tell you what percentage, but I know it's a fair amount. And we talk all the time about trying, you know, are they ready to quit smoking? Have they considered quitting smoking? And talking about if they are, what options are available to help them.
Okay.
State average has been dropping steadily. We're down to under 20%. The range is actually a much higher rate. Regionally, we're higher. We did see a big, huge spike in vaping. And unfortunately, with vaping, 1/3 of the people, which are mostly teenagers who end up on cigarettes. The vaping was hitting the schools very hard last year. I gave some talks to the American Lung Association at the schools, and the principals were there, and they laid out all the vaping supplies that they had taken from students. And I just talked to the vice principal yesterday about it, and they said now they were collecting 3-4 a day, and they've collected 4 this year. And so it's been a big drop. There's still kids who are doing it. There's always going to be a group, but it's not as pervasive and as severe as it was. So it is trending in the right direction. I think the news exposure about the vaping and the side effects of it, that's really helpful, and just continuing getting that word out. So.
Excellent.
I don't think many teenagers are watching us tonight, but I fear their parents or grandparents might be.
And we're all young at heart. All right. Somebody from Duluth is calling. When trying to prevent the flu, is there such a thing as too much vitamin C?
I would tell you that we have some studies that show that high-dose zinc and high-dose vitamin C in the first 1 to 2 days of an infection, even before you might realize you have the flu, can be helpful in not necessarily warding off the virus, but making symptoms less. Too much vitamin C typically results in diarrhea. So we urinate out the excess vitamin C we take in every day, and you might even see that color change in what you are doing. But too much vitamin C is typically resultant in diarrhea.
All right, well, that's good to know. Dr. Dobbs, are there any vitamins we shouldn't take handfuls of?
Well, you definitely need to be careful of the fat-soluble vitamins A, D, E, and K.
Excellent. Okay. Well, here we got another question from Hermantown. At what point are cold symptoms severe enough to see a doctor? Dr. Ripp.
Any opportunity that we have to see people, if they feel they need to see us, we have them come in. If obviously if they're having a fever that just won't break, if they're having shortness of breath, if they're having pain in their chest, bleeding, anything, then they should really come in and get checked. But the typical cold starts off with a sore throat, goes to their nose, goes down to their chest, they're going to cough, and then they'll cough anywhere from 2 weeks to some people 4, 6, 8 weeks. If they're going the usual course, most of us have had colds before. We know what to expect. If it is following an abnormal course, and then I think, then it's maybe time to come in.
And this sort of piggyback off this, people often wonder, well, is it a cold? Is it a sinus infection? When would I consider taking antibiotics and when should I be seen? And we're actually waiting, 2 weeks for a typical cold to even consider that a sinus infection might be bacterial and not just a viral infection. Some of the warning signs of a sinus infection that may need to be treated would be pain on one side, bleeding from the nose, tooth or eye pain or pressure on one side.
And people with true sinusitis usually have that, I was sick, I was almost better, and then all of a sudden I got suddenly worse again. And so, we're trying to be judicious or careful with the use of antibiotics, and I think we've been doing better with it as a state and as a country.
Yeah, no, amen. I agree. We give out way too many antibiotics. And all right, well, here we have another call. And why is the normal blood pressure reading dropping? They used to say it was 140 over 90, and now it's something else. Who wants to grab that topic?
I think the biggest reason is that we have more studies to show us that we can prevent complications of disease by lowering blood pressure. So we actually have a couple different recommendations depending on who you talk to regarding blood pressure. If you're diabetic, we know that we have better chance of having less kidney disease if we lower blood pressure to a certain point. The American Heart Association for heart disease has a different set of values. And the reason they're getting lower is because we have lots of studies to suggest that we can prevent disease.
And I think that's where you need to work with your regular doctor to determine what is the right level for you. And so for some people, we hit a ceiling where adding yet another medicine might not be in their best interest. And so we try and lower it as much as we can without harming the patient.
Okay. Well, Dr. Dobbs, let's say that I just do not want to take a pill for my blood pressure. What can I do with lifestyle and diet that'll help lower my blood pressure?
Some people are sensitive to salt, and therefore limiting their sodium intake can help. Exercise definitely can lower the blood pressure, and then also weight loss helps to lower it as well.
Excellent, excellent. Okay, now here we have a question, another email question. This is great. What types of appointments do you find the most challenging personally? And what types do you find the most challenging or most rewarding? That's a great question.
This is a good question.
It is.
I would tell you that the person who waits till their physical once a year to bring up every single problem that they've had throughout that year is a fairly difficult visit for me. Just because we also save parts of our physical in order to prevent illness and to provide counseling for chronic diseases and prevention. And so I would encourage people to see their doctor when they have medical problems and not save everything for that one visit per year.
Okay. How about Dr. Ripp? What would you
I'm going to go, the most enjoyable are actually when patients come back after a phase and the medicines are working, they've adapted the lifestyle changes that we've asked, and they're seeing it work. Because that's a happy time, because you've been telling me for years to make this change. They make that change, they feel better, things go better. That's rewarding. And it's we are, as I say, cheerleaders on the sideline trying to get people to make lifestyle changes. And we try and just coax them along and encourage them in every step. And so when they do that and they see success, that's always gratifying.
Oh, wonderful. How about Dr. Dobbs? What do you find most challenging and rewarding?
So the most challenging for me would be when we've prescribed medications and offered advice, and the patient seems agreeable to it, and then on follow-up, they come back and say, no, I never started that. I wasn't really comfortable with this side effect or that side effect that I read, or what I read on Google about it, and so that can definitely be challenging. The most rewarding for me would be a toss-up between my OB visits and my newborn well child checks.
Oh, that would be sweet. Yeah, in my job, when my youngest patient's 70 years old, I don't get to see well child checks, but I do have the satisfaction of seeing people that I saw first in 1991 and get invited to weddings and birthdays, and it's just delightful. All right. Well, that was a great question. Thank you. Now here, for our last question, as we're running out of time, hard to believe, a 5-year-old child has a cough and a fever with croup going around the classroom. How does croup present in a 5-month-old or an adult? And what are preventative measures? Anybody?
So croup in a 5-month-old, I mean, it's that typical barky, sealy cough that you see in there, and that's probably worth a trip. If they're crouping, it's probably worth a trip to see your doctor, because there's definitely medicines that can help with that. In adult, the symptoms, adults get croup-like illness, but we just don't get it as severe. Some kids sort of grow out of their croup. Some kids who have a history of a narrowing of the tracheal malacia, they can persist with a croupy type symptoms, more prone to that croupy type cough even as they get older. But adults usually get just, we just get sort of sick and we don't really know we have croup, and that's why we can give it to kids.
Okay.
And our prevention would be washing your hands, covering your cough, eating well, sleeping well.
That's wonderful. All the stuff that Grandma told us to do. Well, this is hard to believe that we're out of time. I don't know how that happened. I want to thank our panelists, Dr. Kathryn Dobbs, Dr. Ken Ripp, and Dr. Addie Vittorio, and our medical student phone volunteers, Kaylee Evers and Lauren Summers and Molly Vale. Please join Dr. Mary Owen next week for a program on depression and anxiety and suicide, when her panelists will be Dr. David Baldas, Dr. Stevamir, and Dr. John Wood. Thanks for watching and have a great night.